Okay, well,
I mean, what now? What's the thought on the best proportions?
Okay.
And the best formula for that?
All right. Do you want me to address that now, or do you want me to wait till the afternoon session?
Why don't we do it now? Give us about 10 minutes on it, then I got a couple of announcements, and then we'll have lunch, and then you can do it. Or do you need more time than that?
Yeah, it'll take some time.
All right, because that's important. Let's go to answer some questions.
Okay, so this afternoon, then, what I'll talk about specifically are the herbs that you would combine together. They give a well-rounded approach to fighting microorganisms of all different kinds. Okay, so that's what we'll do this afternoon. Okay, yes.
Are you also going to be going over a therapeutic approach towards detoxification for the person that is found to be heavy metals?
Yes. Yes, I'll be talking about that also. Yeah.
Where are some of your sources, like the licorice root and things like that? Have you found any good sources of, I mean from purchase source, not in the...
Oh, you don't mean information?
No, I don't mean information.
Okay,
I
you
mean
mean
actual purchase of the licorice root itself.
Wow.
In terms of getting good, clean product and consistent product and things like that.
Okay, here's a response to that right here.
Yesterday you bought the Yoga Journal, and in the back of it there's some advertisements. And one of the places here in the Monterey Peninsula, and they sell statewide in the western area, and they sell straight herbs. It's called Herbal Effect.
Okay, yeah,
They're
Herbal
out here
Effect.
at the Lighthouse,
Right.
New Monterey.
Yeah, they're a good company. Most of I would say this, the licorice root that is produced by most of your reputable herbal companies, which are those that make the rounds in the health food stores and do have very high-grade licorice root, but it is susceptible to a great deal of variation. I have to admit that. There's no way to get around that. The crops around the world are vary tremendously, and so they just pick it wherever they can. But some of those companies, like I don't want to name any names, but there are several of them that sort of have the ability, the connection with Botanicals International and some of the importers. They get first pick on those. And so it's the high volume customers, obviously, that get that kind of attention. And you can get good licorice root preparations from them. Now those preparations are then usually powdered or made into an extract of some kind, alcohol or whatever. But whole licorice root sticks, that's just kind of a hit and miss. I've seen good stuff and I've seen bad stuff in the same stores and all over the country.
By the bitterness, is that what you're saying?
Yeah, exactly. By the bitterness. There's no reason to eat licorice root if it's bitter. I mean, just why do that when you can get the good stuff? It is available. So.
How about Chinese imports and things like
Yeah,
that?
very good. Licorice root, Chinese licorice root is very good. You bet. And if you can get it from Russia, that's a good variety. Spain, Italy, down the Mediterranean, those are excellent varieties, but they're given to a great deal of variability, especially as you get toward Pakistan and over there. Sometimes you don't know what's going to come out of that area. Okay. Other questions here? See, Ed and I both took liberty to introduce things probably in a little different way than what you're expecting this morning, but I think that eventually we'll get into that. Having laid this kind of a foundation, then the things that we talked about this afternoon will make more sense.
You say you can't use it over and over and over. Do you have some sort of therapeutic protocol, or what do you follow as a rule of thumb when you're giving licorice root? You just wait until the symptoms abide or abate?
I don't, what I recommend people to do is that they use licorice root when they need it, and that might take years, But if a person is basically healthy, and let's say they're just going into the cold season and they want an immune system stimulant to take them through that, that's the situation where I think, all right, you use it for 3 or 4 months and then go off of it for a while. No use to overdo that. It's just a matter of, you just get a feel, I think, for these things. As you use herbs, I really believe you begin to get a feel for what your body is, how their body is responding to them. Your own individual biochemical response to these things. And I always recommend that people use themselves as experimental subjects. You are your best subject, essentially. And go after these things and pay attention to how your body is reacting to them. And that's good research. That's good science, personal science. It's not science that I've been talking about this morning, but it's good for you And if you're willing to be your own best subject and really look at it from a scientific point of view as you're doing that kind of research, then record your responses. Make charts and graphs of what's going on. The more access you have to diagnostic tools, make use of them. And just keep track.
Well, that's well and good, but patients want specificity.
Right,
Patients want
okay.
to hit the nail on the head.
Yeah, of course, that's what the patient demands. He comes into your room and he demands that. And that's why we have drugs, isn't it? That's one of the main reasons drugs are proprietary drugs are made, is because they fulfill the need of the patient to have something happen to him when he walks out of your office. Unfortunately, in herbal medicine, that is not hardly ever what happens. What happens is that you are attacking the disease from a more fundamental point of view, and you're getting at a systems approach, if you will, to the thing rather than an organismic approach to it. And so you're building his immune system, and as that happens, he comes back to health. You're affecting the cardiac muscle, so it utilizes enzymes and oxygen better, and eventually he comes back to health. But there are herbs that do have immediate effect, and ginger root is one of them. Some of those guaranteed potency herbs that affect blood pressure or other herbs like mistletoe. A lot of people will use mistletoe in the morning, just a mistletoe tea in the morning, and they'll experience a decrease of blood pressure throughout the day. So there are some herbs that can be used as allopathic medicines directly, powerfully, there's no doubt about it. There are other herbs that can be used homeopathically. And it may be that when you ingest whole herb material, and this is a thesis that I wanted to develop for some time but haven't had the chance to yet, it may be that there are certain herbs, when you ingest them in a whole form, that what you are actually doing is using a homeopathic. Because the active constituents in that plant would be in such minute trace amounts that they may be acting homeopathically within the body. There may be certain herbs that have the exact same effect homeopathically, but they do allopathically. Now that's a phenomenon that would make homeopaths just, cringe in the corner. They wouldn't want to accept that at all. But arnica is used both homeopathically and allopathically exactly the same way. And there are a lot of other ones that are used that way. So a whole herb may contain active constituents in homeopathic amounts, but it may contain other constituents in allopathic amounts, and both of those, although they're different constituents, might have the same effect on the body. When nature creator, God or whoever created the earth and if he put a doctrine of signatures in the plant, which science, of course, dismisses out of hand, there may be more than one signature there. There may be all kinds of ways that we can access the plant kingdom on an intuitive basis and come away winners. And all science can do is verify that sort of intuitive knowledge and extend it and hopefully use it to convert less intuitive individuals over to the herbal approach, if you will, and less intuitive scientists. Okay. Any other questions right off here before we dismiss?
No questions? Any questions?
If you don't ask a question, you've got to listen to Ed. Which will it be?
Quick ask a question. I want to thank both the speakers for a good introduction this morning. Actually, the truth is obvious, but the obviousness is the last thing that we understand. Okay? It's right there in front of us. And I appreciate your coming down and giving us a reintroduction to something that we probably already intuitively know. And feel free to go with what you want to talk about, not with what we saddled you with. It's okay. Okay? We're all here to learn together. A couple announcements. You can pick one of these back up at the registration table. This is a little booklet from the Acupuncture Journal people. And Lowell's books are all available again. And the three that I would recommend from the list is the Lowell's book on odontons, the EAB primer, and Fundamentals of Electroacupuncture. And that's in our first newsletter on suggested bibliography for the study of biological dentistry. We also have a couple of places open for the rafting trip down to Colorado. If anybody's interested, see me, I'll give you a brochure. Gleditch and Hopfer are going on the trip, so we're going to make a seminar out of it and deduct it. And that's the way the game's played, huh? And then I wanted to, if you people are not familiar with, this is our effort at a journal, our current effort. If you're not a member, we'd like you to join, and so that you can get a journal and get discounted seminar tuitions. We have Jochen Gleditch returning on somatotropes and reflex zones, and the 5 functional circuits and the biocybernetics of what this whole thing is about. And the plants that we're being reintroduced to today will also carry this kind of information. And it's very specific, and whether it's a doctrine of signatures or a doctrine of molecules, it doesn't make any difference, because the information is there and it's specific, and it'll have a specific effect on us. But there's variables on the way things are growing, like you said. And I appreciate you talking about that, because that's one of the things that we face. One of the problems here is that in 1913, when the Flexner brothers made their report to the government, and they tried to standardize the medical school curriculums, they threw out electric medicine, eclectic medicine, nutrition, herbology, Ayurvedic medicine. All of that, they closed them all down. There were some fly-by-night places, and not quite as motley as our group here. But anyway, so what they substituted in place was pharmacology, and that's all that the physician knows. He doesn't know the extent of the other things. And I knew intuitively that I didn't like pharmacology, and mainly because they had a big book like this, Goodman and Gilman, remember that? Well, anyway, that's all I wanted to say. So, what time is it now? 12 o'clock? Why don't we come back at 1:15? 1:15, okay with everybody?
I like it.
Thank you.
You're gonna lock up, right?
Yeah, we'll lock up. More free-form things going on. We want everyone that hasn't turned in their permission slip signed by their mother to see Carol and get that turned in, because we're going to go on an herb walk. And one of the purposes of this walk is to introduce you to the things that are out there. They're all around you and they can make you well. And Ed thought this would be a good way to physically illustrate what we're going to talk about. They got a big crowd over next door. Pete McCloskey's talking about what has happened in the past in the world. But you got to realize in this room here, we're going to make it happen. And after we just get some more information, or continually getting information. So Ed, why don't you lead us? If you want to say anything before we go over there, things we want to look for or not look for.
Just need a note on the door. It's gonna
Or
be.
watch out for snakes or whatever.
Why don't we just go to the seminar, and then when we get a little break, we're a little tired, and then we just take a walk, and kind of
Okay.
break it up kind of nicely.
That's fine with me. I figured either you walk off at dinner, you ate, lunch you ate, or else you sit here and wait.
Well,
and walk.
All right, raise their hands. Who wants to go for the walk now or later?
It doesn't matter.
All right, why don't we lecture a little bit, and that way it'll give everybody
Okay, well, I was,
filter in,
that's what.
and then we'll do it. Okay, yours, Ed.
Okay. Let's see, what, see my notes out. Oh, I know. You want to get more involved in sort of the history of the use of plant materials during a time when they were used clinically in hospitals by MDs. Then these books that we've kind of reprinted from Eclectic Institute deal with this era from approximately 1850 to 1927, roughly. And what it was what I call the period of eclectic medicine. And this group of physicians started breaking off from the regular medical practices, which were things like using calomel and mercury and leeches and all these bloodletting systems that these doctors didn't consider very efficacious. Well, they consider them healthy to the patient, even though the patient might have survived the therapy. They weren't. They thought there were better ways, so they started using plant materials more so. And so they formed their own colleges, taught throughout the country. Probably had about 13 colleges during this time. The most famous one was in Cincinnati. There was also some in Memphis, Tennessee. I think there was one in Pennsylvania, one in New York. Florida, I'm not sure of all the schools, but they eventually all closed around 1905, I think. And during that time, one of the people instrumental in it was John Murray Lloyd. He was a self-taught pharmacist, and he formed the Lloyd Brothers Company, which has since been purchased by Pennick and other herbal companies somewhat after Lloyd died. And then that's been purchased by Herx, which is a German pharmaceutical company, actually the same company that makes Lasix that I've talked about before. Those companies don't use the herbal products. They don't really manufacture the herbal products. But Lloyd was a highly decorated or commemorated pharmacist during his time by the Remington Society, the Pharmacy Society of Remington. So he was very knowledgeable, and he produced what was called specific medicines. Oh yeah, so this is good to talk about because there's a little bit more that I didn't have in my notes. But he produced specific medicines at the time, and they were done with. I've got a picture of the machine equipment used, and anyways, I'll talk about that more fully when I get to the slide. But what happened was he became so popular. The medications became so popular that they became pretty wealthy, and they established this trust fund, which formed this library in Cincinnati called the Lloyd Library. And if you ever go to Cincinnati and you want to do research on botanical medicine, that is the place in the U.S. to go. If you're there, you're probably going to be the only other person there for the whole week. You might see one other person come in. The books are all behind the door, so if you want something, you have to look through the card files and ask them to get it for you. But the librarians are real helpful. They'll go get the books, whatever you want, and they'll Xerox the material that you want and send it to you later or something like that. And it's about a 4-story building, still on the site of where the Lloyd brothers practiced, and it's number 7 on the list of libraries to be saved in case of a national disaster for 2 reasons. One is because it contains all of the real historic art and of a lot of the botanical medicine, a lot of the books of the 14th century and so on that have these big pages of original artwork, but also they keep current on about 500 journals, all on botanical medicine and everything in different languages, French and German and so on. So, and they buy other journals. So it's a real gold mine of information, and no one knows about it.
It's called the Lloyd's Library?
Lloyd Library. Yeah, in Cincinnati. Yeah, and actually, if you want, you can call them up, and they'll try to facilitate your requests over the phone too. So if you see something, particularly anything in botanical medicine that's kind of dealing with that period, there's a good chance that they have that book.
Just American botanicals, basically?
Well, pretty much. Now that whole library, to give you some idea of what these books are about. This book was printed in a reprint. This is a reprint of a book. It was in 1900. And I've been to the Lloyd Library several times, and I would say that all that material that's in the Lloyd Library on botanical medicine that had to do with the eclectic period has been synthesized and narrowed down to this volume of book. So it's a very astute book in the sense that it has a lot to do with the uses of plant material during that time. And it doesn't always address kind of the issues sometimes that we're still looking for more as to further our knowledge, but what I end up finding is that the scientific information that comes out just substantiates what's already been written down here. So I don't have, that's the other reason why I don't get too involved in the scientific data all the time, is because really I'm still learning how to use the stuff that's already right in front of my nose. I'm not waiting for some scientist to reinvent the wheel. It's here, and these books give real specific dosages and information. This one's called the King's American Dispensatory, and That's by Felter and Lloyd. This is a good one for if you're. I don't recommend this for the beginner because it's pretty expensive. Like that set's $125, but well worth it if you're up to that speed. I'm dealing with it. This is a little different. This is Cook's Physiomedical Dispensatory. This Cook was physiomedicalists, which are sort of precursors of the eclectic periods, and they became somewhat antagonists because the eclectics started using more of the poisonous herbs that we don't really consider poisonous that much, which is like aconite and roost tox, apis even, gelsemium and so on. Physiomedicalists didn't believe in that. They believed more in the naturally kind of physiological functions of the body to heal itself, and didn't want to give a poisonous substance to stimulate healing, like you might give gelsemium or aconite for that type of a purpose, just to really introduce, like nux vomica, for instance, a strychnine. They didn't think that was therapeutically in their philosophy, so they kind of became divergent.
When you say eclectic,
Physiomedicalists?
right, I mean,
Yeah.
were they opposite poles? Is that what you're saying?
Well, I think the eclectics were trying to advance medicine a little bit beyond, get more into the science of it, and the physiomedicalists were still kind of dealing with, they were sort of an offshoot of the earlier herbalistic approach, and more of I think there were a lot more religious philosophies in tone with the physiomedicalists as opposed to the eclectics. The eclectics were out there just trying to do a better job than what was being done on the field, and weren't too much concerned about the totally refined. They refined it later on and got to be very good. Now what they would do, what's different is that what they would do is with specific medicines, which several drug companies ended up making, but they would use, take a 4 or 6 ounce glass of water and take out the tincture like I showed you before, which is the kind of tinctures we make, and put in roughly 10 drops of their specific medicine. And then the dose would be like a teaspoon 4 times a day or 5 times a day, and so that glass of water would last you about 4 days. Therapeutics, that's fairly potent therapeutics. So the way that specific medicines were made hasn't really been found. It wasn't left behind as a legacy. So we've been trying to discover how they were made and bought the equipment and found the equipment and so on. I'll talk about that a little bit more. Everybody's here. Let's go take a walk, because what I'm going to do is take this walk for one reason. Is one for me, and I think probably at least some people here this way, is that if you only hear information off the next 2 days, it doesn't leave much that sticks with you when you go in your practice and you're kind of really trying to figure out what to do off the top of your head, standing up and got to shoot from the hip or think on your feet or whatever it's called. And I think just by going out and taking a look at a few plants and let you know what's there, and also give you some connection with that'll be important. And the other thing that's important too, and we've talked, everybody, Dan has talked about this a little bit too, is that plants have a mind of their own, and they have an energy, and they like to be appreciated. The Native American Indians, and I'm not going to go into this very much, but the Native American Indians always did a ceremony, a ritual, or a tradition that they did with plants materials, and they respected plant material very much. And I think it's important that you see plants that they grow here, and they're not here just to serve mankind. They're an integral part of our whole being, and the more you get in tune with that, at least some aspect of that, the better it's going to work for you. And when you give a plant, if you see green as opposed to a capsule that's been processed and ground up and everything else, I mean, you're transmitting some energy there that's not just a synonym for a pharmaceutical drug off the shelf. Here, count 10, take 1 4 times a day, and call me in the morning. So this is not just an exercise in tomfoolery or fundamental things. It's an important aspect of botanical medicine, and it may not be scientific, but I think as if you branch out and you keep going into this field, you'll find that what I'm mentioning here has some validity, and it won't be scientifically founded for some years. Let's go. Anybody has good shoes on, doesn't want to go? Okay. Probably get slightly wet.
Dan will be back.
You'll be back.
17 a pair.
17 each?
No, a pair.
I can afford this.
Okay, so anyways, I was trying to think about what you all paid to come here in terms of time and energy, and time out from your work and so on. And this fellow here, no, I think I had it adjusted. It's just a small picture. I haven't improved this. Oh, that's better. Yeah, okay. And this is Einstein. He's just discovered that time is actually money. Now we need to turn off the lights, I think, so I can get some better visualization. This is I was at the Lloyd Library in Cincinnati and just happened to arrive on a good day when I had asked them about a year ago if they would ever clean out their stock of old books and sell the duplicates. So they did, and this is the Eclectic Medical Dispensatories at the top corner there. The Eclectic Medical Journals where they wrote journals monthly or whatever, and all the way through the first 2.5 shelves there are the Eclectic Medical Journals from 1854 to 1937, 39. And I've been going through and gleaning out the literature from all those and trying to compile material that I think is pertinent and reasonably correct for use today, and putting that into this book that I've been writing. But the book's already full of data now, so in the next volume a lot of those gleanings will be in there. The two books that I showed you before, Volume 1 and 2 of the King's American Dispensatory, have a lot of information that would be a duplicate of this, but this expands on that topic, so it gives you more depth about that kind of information. This is one of the Lloyd Brothers journals that came with some of those books that you see, and tells about some of the products. Liberdol was a external remedy that contained some things you might not get away with being able to make these days because people might reject it, because this contained a lot of tobacco. It was very effective for croup and so on, but one of the things was the tobacco extract that was the major component of that, along with lobelia. This is just sort of a visual, one chance to kind of go through these real briefly and not even talk about them much, just to give you your eyes a treat from coming in from outdoors again. And at the very end, when I'm done with the lecture, I'll go through these one more time tomorrow. Tell you what plants they are. This is a garlic, wild garlic. This is a yarrow, flowers, diaphoretic, same thing. This is a plantain you saw. That's the plantain up close. It's St. John's wort, or hypericum, it's called. I'll talk about this. It's just recently discovered to be antiviral. No, it's probably been known before, but it's been published now a lot about it. This is the flowers up closer, and then here's a close-up. Can't see that, but you can see how that's pollen there is really red, and that's an important constituent to find in the plant. You want to see you can see how even on the petals, the lower petals there, how that pollen is dripped off and colored those yellowish petals red almost. Comfrey flowers. Comfrey's been noted probably one of the more poisonous plants we have around in terms of cumulative effect from the pyrazolidine. So you want to be a little careful using comfrey these days. So that's comfrey too. That's just a wild rose. This is thyme. And actually what happens whenever you make herbal extracts, you take the fresh herb like thyme or whatever, and you chop it up and you put it in alcohol and water, let it set for a couple weeks, and then you wrap it in a cloth and you put it under this press. And you have to press like a hydraulic press. And you squeeze out all the alcohol and so on from it. So that's how I press thyme. That's a change, yeah. Alcamellia, this is lady's mantle. Somewhat used for leukorrhea, feminine disorders of various kinds. The bees like it because it collects water in there and they come and take a drink. This is shepherd's purse, which contains in its leaves and things some acetylcholine, supposedly. Well, it does contain that. However, keeping acetylcholine stable and getting it through the digestive tract if you take it orally is up to question, but it still seems to have that pharmacological effect, even though it's not supposedly in there. Products seem to work very well for particularly uterine bleeding, so on, from various causes. Anytime you want a cholinergic effect. That's its petals up close. This is a small willow herb, popular in Europe. It's used for prostate situations, prostate problems. This is stinging nettles. Close. I'll talk about that. This is Petasites type, and this is actually coltsfoot. That's not Petasites, but this is used more for cough and so on. Expectorant. This is calendula, which is a very good immune stimulant, and you can grow it, and it's also growing out here as you drive in, you'll see calendulas growing out here in the driveway. You can use the flowers, the leaves, the stems, and so on. Calendula is used homeopathically a lot. It's also used topically as a good wound healing thing. Works great for children, for cuts and bruises and little scrapes and so on. Real effective. That's the flower up close. Easy to grow. This is eyebright. Nothing particularly great for dandelion we talked about. Another one.
So that was liver or kidney, right?
Yeah, liver and kidney, diuretic effect for the kidney. This is horsetail, equisetum. A little bit more coming out there. This is looking in at the branch, like into the stem of the horsetail, looking at it. Looks like, they call it joint grass too. And then I think, although I stepped out, I believe Dr. Mowrey talked about doctrine of signatures, I believe. And equisetum, horsetail, is used as, more or less it helps with connective tissues. So like the joints in particular, rheumatic complaints and so on, horsetail is very effective. It has silicic acid in it too. And that seems to have an effect for the connective tissue, particularly around joints. And so then if you get to the doctors and the signatures, and here's a picture of it. So it looks like some of the distal some phalanges you might have seen in anatomy class before. It's very specific for that area. Okay, I think I mentioned all these people. This is a picture of Dr. John King, one of the eclectics, the one who probably one of the King's American Dispensatories founded, talked about. He wrote the book. Dr. King was kind of a practitioner and a pharmacist too. And what happened, just give you some little story here about medicine, is that the eclectics were experimenting with herbs lots of times, and they ended up finding these resins, concentrated resins like leptandrin and podophyllin, these things that would float to the bottom of their extract. And they used these for a while, and they were a very concentrated material, but they only contained a small part of the constituent of the plant, didn't represent the whole plant particularly. So they were sort of, after a while, they were found to be very, like there was podophyllin resin and so on, they were found to be very cathartic, very like forerunners of our drugs, which is what they ended up being. But they, soon after being brought into the eclectic armamentarium, they were soon rejected by the eclectic, so they found they didn't really represent the whole plant. They had very specific uses. They didn't work the same as the whole plant material and soon fell out of favor. But not soon enough, because the drug companies picked up on these, started producing them in mass, and established colleges then, right around the early turn of the century, to teach physicians how to use these particular concentrates, and therefore established some of the strongest monopoly in that whole thing. Is how it really came about. Part of how it came about. The eclectics then were pretty soon that the whole Flexner report and so on, and this is what's happened, and now it's starting to come back again. These are the Lloyd brothers, John Uri Nelson. That's Nelson in the front, and Uri's on the right. These are friends of mine. I think maybe I'm recreating something that they would like to see going on. So this is John Milton Scudder, an MD who's very intelligent, wrote a lot of the eclectic medical journals, and big part of it. Okay. You brought up a question earlier about analysis of. Also, someone needs to tell me when it's time to cut off here, and keep an eye on the time. Okay. Question about analytical analysis of, I think we're particularly talking about pesticides. Well, we just use standard laboratories for analysis of ours, and if you need testing done, there's lots of places that can do those, and they're independent labs. The other thing that we do in the college there is do some thin layer chromatography, and this is just a very simple setup that you can do. And what you do is that's our fresh plant material that we've got there, And we've taken material, ground it up, and dissolved it in a solvent system. That's what you see, those little jars are containing a solvent system. Then, those two white panels you see in the background are silica gel treated glass plates. They have silica on them, and then you take little fine drops of this solution and drop it at the bottom of that plate, and then you stick it in this thing that looks like a fish tank that has paper in it. Stick it in there, and at the bottom of that you have your solvents. I don't know if anybody's seen thin layer chromatography. You have solvents down there, and you put a lid on it, and then the herbal extract migrates up to that plate and produces a fingerprint. You can kind of vaguely see it on the one on the right that something's been done there. These are kind of crude plates, but there's some better ones here that just give you an idea. So, now the reason for taking a walk in the herb garden or outside and showing these pictures, because then when you break it down and you look at it, thin layer chromatography, this is what's inside. So you've got different material now. You've got something else. Now you're looking at the chemistry of the plant, having a different aspect. So this is just I don't even know what this is from. This is one just to give you an idea of all the variations that you can get from one plant. Okay. I know. Okay, so then there are other methods of analysis besides thin layer chromatography. This is a sample of thin layer chromatography, and then there's HPLC, which is high pressure liquid chromatography, which is another method very similar, but it just uses graphs up and down to measure constituencies. And then, of course, we've always analyzed things and gotten their chemical structures and so on. This is a blow-up of some HPLC testing done on echinacea that we did a study on. So it just can show the points. This is upside down backwards. But anyways, this is all one plant. This is a sarsaparilla. And various forms the way sarsaparilla comes. If you start at that one black dot is a solid extract form. There's another plant called sarsaparilla. All these are called sarsaparillas, common name sarsaparilla. So if you want sarsaparilla, there's no telling what you'll get, and no telling what form you'll get, because that dark black spot is actually a Mexican sarsaparilla. I haven't figured out exactly what his name is. And then there's some from Jamaica, Jamaican sarsaparilla, and so on. So using common names of plants is, if you're talking about common plants, lots of times when you get confused, you get the wrong material and it works, and sometimes it doesn't work. It may be because you're asking for by one name and somebody else is giving you a different thing altogether. So now that's good, because this is the one that I guess in the middle there's two plants in the middle are actually the same plant just split in half. And then the two on the outside are the same plant split in half, so in other words, cross sections, and or longitudinal sections. And the one in the middle is Echinacea angustifolia. The one on the outsides is Parthenium integrifolium. In this country, for at least the last 10 years, most of the companies that have been selling Echinacea have been selling Parthenium integrifolium. The reason that that's happened somewhat is because the common name of that is Missouri snakeroot for both plants. Snakeroot's both plants. So the people that dig it up call it snakeroot, and they get snakeroot, and Echinacea is called snakeroot, and so it's not as common to find it. So they substitute the other snakeroot. So if you ask for Echinacea angustifolia, supposedly you get Echinacea angustifolia, but if you ask for snakeroot, you may get anything. And if you do the analysis, of course, you can figure that out. The reason it was finally discovered that this was a problem here in the U.S. is because someone did a paper on it, finding that in Germany, finding that Echinacea had this one of the species of Echinacea had this constituent in it that none of the other species of Echinacea had. So he wrote a big article about it, published in a German pharmaceutical magazine, and then got a hold of it, translated it, contacted him, and he said, oh, well, since that article was published, he found out that the voucher specimen, which he was using for Echinacea, was not Echinacea, it was Parthenium integrifolium. Then he subsequently analyzed material all over the U.S., plus a lot of the European stuff, and found that indeed the material they were using wasn't Echinacea at all, but Parthenium integrifolium. So, it's amazing how that plant worked, or how it was continued to be purchased, because it's one of the bigger selling plants around, and yet therapeutically, and people were supposedly getting results, I guess. I mean, I don't know if they were. So, there was some debate about it. A lot of companies came together, decided what to do about it. Some people suggested that, and actually it's on the labels in the health food stores, that since echinacea is the correct botanical name for echinacea. It has a common name, but it's not used a lot right now. And they suggested that since echinacea has been mistakenly called that it's actually Parthenium we're using, or not we're using, but that a lot of companies were using, that the name echinacea should actually be the common name for Parthenium integrifolium. So they continue to sell echinacea with parenthesis Parthenium integrifolium. So you'll see on the front of the label golden seal and echinacea. If you look on the back, it says echinacea parenthesis Parthenium integrifolium. So it's bad enough that plants get changed, the nomenclature gets changed by botanists, because Lomatium has gone from Leptotania to Lomatium to Leptotania. Salivum has gone from Salivum to Cardus to Salivum and everything else. But now that we get manufacturers playing with the name too and saying, well, just because since we've been using the wrong plant, we're going to change the name to fit our, and the people that have been using the right plant, they can forget it. So you got to deal with that too in herbal medicine. So this was an analysis of, this is actually a crayon drawing of what came up on a TLC plate, verifying.
Is this how you verify that that's the herb that you're getting? You have a fingerprint from this cytochromatography or whatever it is?
Yeah.
And you make sure that that's what you're getting?
Well, it is, if you get a powdered material, it's nice to want to have it checked out. If you get the whole material, it's sometimes possible. You usually always ask for a voucher specimen of the whole plant first, which contains the flowering part of the plant and so on. Like this fennel and anise out here that's not flowering, I don't know. I'm not that good of a botanist that I could identify fennel from anise just by looking at the leaves. I'd probably have to wait till it flowered. But then if I did a TLC, I could do it.
I see.
Also, substitution of material. This is prickly ash, a tree that grows in Texas, and it's got these knobs. Prickly ash is another plant that's commonly adulterated because there's a prickly ash that grows in Missouri also, Aurelia spinosa, but neither one of them are used. They're not really interchangeable. Interesting thing, echinacea has a real tingling effect to the tongue. So if you ever wanted to taste, you could get roots of echinacea tasted. It should have that tingling effect on the tongue. It should numb the tongue. So you could tell Parthenium and echinacea apart real quickly. Prickly ash has got a really numbing effect on the tongue too. So if you wanted to be really smart, you could take Parthenium, adulterate it with also mix in prickly ash, and then it would tingle. So you can really sophisticate the products. That's a lot. You can get into a lot of counterfeiting of herbal products very lucratively, because some things are very expensive, and the more you adulterate them, the more money you can make. And if people don't know the difference of how they're supposed to work, then who cares? And an example is Parthenium has been sold for so long and seemed to have worked. But my thing is that I don't know. It takes a lot, and this is kind of, some probably think this is off the subject, but just because you tried an herb, that doesn't mean that plant isn't effective. If you don't know the difference in the quality of the material, there aren't a lot of manufacturers that you can really trust. So you've got to know something about the material, and that's a little bit of what this whole thing is about. So you got to get some feel for it. It's sorry that it's not just so cut and dried, but it isn't.
Do you find that you get product that has been substituted, things like that, in the manufacturer?
Oh, well, in collecting herbs, you get things, using the common name, you can expect anything, and people don't intentionally do it, but it does come. Calendula, for instance, marigold is a common name for calendula, and there's other marigolds, you see those other ones that we're more familiar with, those little tagacetes. People collect those and send us to those for marigold, but they're not even the same genus. They're in a totally different family. Family.
How do you determine dosage? Say on things like you purchase from you?
Well, usually I try to go a lot about the dosages that are given from the eclectic medicine, like from those books. There are a range of dosages depending upon what that's like. Now, they use specific medicines, which I've basically figured out about how strong that is versus what it is that we're doing right now. So have to alter the dosage somewhat. But the best way to do it, there's several other books that I can show you too. There's one book written by Scudder that I mentioned that has called Specific Medication. It just talks about the herb and pretty much just very succinctly, and then gives a dosage. And you can look it up in there and get a pretty good idea of what the dosage of a tincture should be. Then if you want to calculate equivalent dosages of capsules and powders, then it's another
Say, for instance, say we get something like BioStim.
Yeah.
And you use 10 to 15 drops in a glass of water.
Mm-hmm.
How critical is it if you give 30 drops? make it better? Or?
Well, each plant is a little different now. If with echinacea, if you're trying to produce an immune stimulation somewhat, you usually start out, there's a bell-shaped curve like I mentioned on dosages. You usually start out one of two ways. Either you give a very strong dose over a few days, or else you extend the dose over maybe a week or 10 days, and you can use either two of the dosage regimes that you choose for that. I mean, there's no cut and dried method for determining dosages, but you can get, what I would suggest is just to get a toxicology book so you don't go over the dosage suggested, which is pretty hard to do with most of the plant material. And then get a relatively simple book that gives a pretty good idea of the range. And then you've got to play with it a little bit there, depending upon what I just call the toxicity of the patient as to how fast you want to. Do you want to put them through a healing crisis right away, or do you want to kind of just gently motivate their GI tract, for instance, like with liver dosages? And of course, there are some things where there's definitely dosages that you don't want, that you don't have a choice between the two, maybe like in hepatitis and so on. But that's how I kind of determine the dosage.
What about, like, say on biostim on frequency?
Yeah. Well, I use it a lot like I do with low-dose homeopathic medicines. You give it at a dose until you get a response, and I leave it at that dose for a little while, and then I'll start dropping it down. Evaluate the response, and then go up until you get pretty familiar with it and get a rule of thumb for when that patient comes in the door. You can kind of get an idea of what dosage they're going to need, regardless, and that's pretty vague, but it does take a little more than just reading it, what it is out of the book. You'll get better if if you want a straight dosage, you can read a lot of books that'll give you pretty much a straight dosage, but if you want to get the best effects, you've got to use some intuitiveness or some other method of evaluating how far up to go, because a lot of dosages there aren't going to be appropriate today. At least I don't. I usually use, when someone says, book says 10 to 15 drops or something, I usually give a dropper full to start with, as when I'm just beginning to learn how to use it. Now I hope to be able to get down to where I'm using lower dosages, like just that dosage, and that'd be very good. And I think that the dosages that are recommended in the Eclectic King Suspensory are really accurate methods, and really accurate dosages, because they've been supported by so much other documentation that I believe that. But to get it to where that actually works with a patient, I've had a pretty hard time getting that good of therapeutic effect from those dosages that they suggest, so I usually go a lot higher initially. So I'm saying I don't think that we've yet achieved a good, between the manufacturing and the application, I don't think we've achieved a good flow of knowledge yet where we can talk about it real clearly, except in certain instances, certain conditions. But in general,
I don't think we can, because like you said, we may have different strengths, we may have different ways of manufacturing.
well, that makes it confusing too.
You have different timers when it may be picked, when the energy is different in the plant.
Right. Sure, yeah. It goes without, it doesn't go without saying, but a plant can change its constituents from the time, it can go up and bloom and have real high constituents at the time it's blooming, and one day later the constituents are dropped considerably if that's the constituent you're looking for. It's practically devoid of any of that activity in the plant at all. So, in Europe a lot more, you got more, I assume there's more sophistication. I think there's more sophistication in a general background of knowledge, but I don't know how effective they are with the application of their material. But they certainly know a lot about it. And I think as we get more and more familiar with using plant material, we'll develop a really good fine-tuning of what's appropriate, and there'll be kind of standards as to not only the standard constituent, but more like an understanding of how this plant picked at its peak flowering will have one effect. Maybe you don't want it when it's flowering, it's got a different effect. So at this point, I can tell you that what I would do, knowing the wide things that you'll come in contact with as far as product diversity and manufacturers and so on, is to take a look in the book, get an idea, give that dosage to start off cautiously or a little less than is suggested, and then try to build up until you get a response. And then if that doesn't work, give more. And then if it doesn't work, we'll use a different manufacturer.
Do you have to use an herbal range remedy, say, if you're going to try to increase the flow of blood in the spleen? trying to, like in our mercury intolerable patients, a lot of times this is where I'm focusing it. And I was wondering, I use homeopathic range, but I'm not always using an herbal range.
You say herbal range? Drainage.
Yeah, something for lymphatics.
Oh.
So if you're trying to clean liver or
Yeah.
spleen or something,
That's
you
right.
have to
I thought
go
you
to
said
a liver drainage.
Well, okay. The usual scenario, I think, is to evaluate the patient and see if you think their lymph system should be stimulated. And to me, it always seems like a good possibility, particularly if you're using something, if you need something that's kind of an acute condition. So usually I stimulate the lymph system, and then because if that lymph system is backed up, I'm sure most people recognize this, but if the lymph system is backed up, where's all the circulating garbage that you're starting to clean out, all the breakdown products of all the cleansing you're doing going to go? It's got to go either out the GI tract on out, or it's going to be picked up by the lymph system, excreted through the skin, or it's got to be expelled by the lungs through some types of breakdown of volatile components that might come out through the lungs and so forth. So using all of the emunctories available, which is basically the systems of elimination, it makes some sense to stimulate the lymph system initially in most cases. So, but I don't always start out with the same one. There are certain reasons for using iris versicolor, which is the lymph system, ceanothus, phytolacca. Well, ceanothus, ceanothus. That's that purple bush I showed you, kind of like, that's ceanothus. I mean, that kind of like one. And so then you've got iris, and then you've got phytolacca or poke, pokeweed, and there are others to think of them offhand. Leptandra, probably. Leptandra could be used. So you can use. So yeah, generally I generally use a lymph thing. If the way I do it is two ways. The eclectics did it this way also. Is they use single remedies instead of formulas. And there's nothing wrong with formulas that I can see, but it's nice to change the formula, because if you stimulate the lymph system, you get the lymph system flowing, get that cleaned out, then there's no point in continuing to stimulate the lymph system anymore. So that lymphatic stimulant should be dropped from the formula. Then, if you're producing something that has an effect on, at the same time, affecting the liver and creating, normalizing enzymatic processes in the liver and draining the liver and decreasing the congestion in the liver, for whatever reasons that may be due to, then after the liver is pretty well cleansed out, then you don't necessarily need to keep stimulating the liver with cholagogues or that. And then the other thing that's not often discussed is that you can also use a bulking agent like psyllium seed or some other laxative to push out this bile that's being dumped from the liver because of this cleansing effect that you're giving it. So if you leave the bile, if you're doing a liver cleansing process, and you're leaving the bile in the GI tract to be reabsorbed and form, more porphyrins or whatever breakdown products, and then the patient has to deal with those breakdown products later on, or then that can be a problem. So usually, dose-wise, and also the way you apply it, depends upon all the parameters that's going on with the patient. So if I see a patient that seems to be needing some type of, let me think of a condition. Well, I've got those flow charts that we're going to go through.
Can we get copies of those?
Well, it's 180 pages. That's the only thing. And I was going to do some pages of each thing, but then I thought that doesn't make it real clear either. So I'll try to figure out a way before tomorrow to kind of give you some handouts of some of the pages, so at least we can go over some of the pages of each of the sections and give you some idea how it works, and that rather than the whole book. Because
I
180
can make
pages.
some transparencies if you want.
Oh, great. Okay.
Project them.
Okay. Good. Yeah, that'd be good.
So you give me.
Okay, I'll give you a few pages then, and we can do like 2 or 3 pages of each system, and then I'll give you some idea. Because it does, empirically, the way this book is set up, empirically, this is how you approach it, because it's just sort of been worked out that way so many years. Now, it's not as good as the Chinese system, I don't think. At least that's not the impression I'm given. But But it is a good place to start. I mean, it does work really well.
So we get some flow charts on like kidney and liver, some of the major organs that we're looking at.
Yeah, I'm going to give you urinary. I think in that brochure that was handed out as far as the conference was, I listed like all the organ systems that can be addressed. So there's urinary tract, liver, there's GI and heart, and so on, and mammary and female use, and so on.
Say, for instance, a person has chocolate through imbalance in its veins and through its lower abdomen. How many herbs, or if you were going to deal and you didn't have a combination of a single remedy, what would they walk out of your office with?
What was the symptom? I mean, the signs?
Pancreas and dysbiosis or something.
Well,
Just an idea.
okay. Okay.
This is something you can try these if you want. You can pass them around or not. But if you have a cup or something, you want to pour some in. I'll explain this first. This is just an example of something I can talk about next week.
This is called Glyconda. This is one of the products that the eclectic doctors made. Now, the good thing about this particular product is if you want to try a dose of this, you pour out about a tablespoon dose, which is good because it's called neutralizing cordial. It's an old formula. Been around for about 200 years. Don't put it in water. Just put it straight. You know. Yeah, you probably want to get. I don't know if you want to get a different. Yeah, you just put it in a. You can do it like that, or put it in a cup or something. Do we have extra cups back there, or coffee cups if you want?
There's some plastic glasses.
There's some plastic glasses back here. So pour about a tablespoon in there. Now, I'll tell you what's in there. Basically, this is telling you how to build a watch to answer this question. But
Before I drink it.
I'm going to tell you what's in it. It's got glycerin in it, and then it also has peppermint. That's the main thing you'll taste, peppermint oil. It has turkey rhubarb, and it has cinnamon and golden seal, and potassium bicarbonate.
It's more if you need cups.
Okay. Yeah, does anybody want some cups to try it out? It's called neutralizing cordial, and it's like a cordial because it tastes like a little bit like a aperitif after dinner drink, and so on. All right. Now, this is one that the Lloyd. What's that? This is.
Just talks about it.
Yeah, no, it's good. It's addicting. The Lloyd brothers had improved on this they used glycerin as a base rather than lots of times sugar was added or honey or so on and produced this way. So they used this glycerin, and it's kind of why we duplicated the formula. But in this, you have, to answer your question, Gary, if this patient has this complaint, normally the Chinese always start with, if you don't know where to start with the earth, which is the stomach area. And we'll work on improving digestion. And lots of times that'll improve all the other conditions. And that generally makes pretty much sense. So what this is good for dyspepsia, flatulence, colic in children, digestive disturbances, etc. So on. It has a wide variety of applications in GI upset, GI disturbances. So that might be enough to start this patient off with. And maybe that's all I do the first time. Depends on what else you see there. But typically with that thing, I would usually try this as a digestive aid. I'd start him on dandelion to help clean up the liver a little bit, because that's a real simple one, non-toxic virtually, and it has a wide range of applications. And I'd I'd use the freeze-dried dandelion. I like the freeze-dried. You can use dried dandelion sometimes. You get good dry material. But in the freeze-dried, I'd use about 1 capsule 3 times a day for the first 4 days. And then I'd tell them to boost it up to 3 times a day. And that will have a pretty good-sized cholagogic effect. And I'd also be telling them to start to high bulk with lots of vegetables and whatever else they might be able to tolerate, or fruits and things. But whatever kind of aid you want to have them on. I mean, what kind of diet you want to have them on or not. Or also to just give them psyllium seed or guar gum or something like that to move this bile that they're accumulating out of there. And then the ceanothus works really well as a lymphatic stimulant. So does poke. Phytolacca is real good, but that one's pretty. Yeah, phytolacca. Before I forget, phytolacca, poke, although it's not normally known to have this effect. Some of my clinical experience with that, and that in pain associated with, I'm not sure exactly what the diagnosis would be, but it had to do with dental pain associated with, say, a filling that's dropped out, and they're getting dental pain from that. I found that if I had a lack of drops right on that tooth, boy, a fresh plant material has to be fresh. So like a fresh tincture like we make, or whoever other companies make fresh plant material, that knocks out that pain really quick, like almost immediately. And I also seen it written down, it's documented as that way too. But I had some personal experiences that working. Also, plantain is commonly thought of homeopathically for dental pain too. Plantain, well, it's Plantago if you're looking it up botanically, Plantago, Plantago ovatum it's normally called, or common plantain. That's called white man's foot or something because when he came to this country, every place he walked, plantain grew up behind him. So that's a weed. So anyway, I usually start. What I found is that you don't have to use a lot of these real strong plant materials to get people well. They start to respond. Dandelion is a bitter somewhat too, and you can also give people bitters to help stimulate their digestion lots of times. And normally bitters are supposed to be taken in the mouth and to chewed or to at least gargled with or something and swallowed because you stimulate that whole salivary digestive system there to produce reflex hydrochloric acid production and other digestive functions too. And sometimes just somebody getting a good dose of bitters. And dandelion greens do have that bitters effect. The greens as well as the root has a bitters effect too, even though you don't necessarily have to chew it up, but it's better too. So,
Are you talking about stomach right now, or?
Well, he was asking me a question about if you had that syndrome of,
Pancreas.
yeah, kind of backed up thing. Right. Now, of course, if you know it's a digestive system, complaint from the start, if you really think it's lack of something, lack of HCl, lack of pancreatic fluid, lack of this, lack of that, well, then there's a different approach that you might use instead. But, like I said, if you don't really know, then the Chinese start from the center, they start from the earth, the stomach, try to improve that first, and then branch out and try to get that thing swollen. But normally, what I found naturopathically, one of the best areas to start with, if you have any kind of skin problems, if the person also tends to have a lot of skin things going on, then usually that's associated with the liver. You see a lot of skin complaints, and cleaning up the liver will work real well. In fact, the eclectics used to use, if a person had real rough skin, real bad skin, they used to have good skin before, but all of a sudden it's becoming kind of rough and granular, they'd give them berberis or Oregon grape, which is very similar to golden seal. And it's a bitter, and it's like the same thing, and that tend to make their skin real smooth again. And it's a liver herb. So there's that constant turnover.
Same berberis they use for kidney?
The Chinese?
Yeah, same berberis.
Yes.
Probably, yeah. I'm not sure of the Chinese species. Yeah.
Kidney too.
It could be kidney. Yeah. It's not a diuretic per se, but it could have some kidney functions because it is basically antibacterial, antiseptic, so to speak. So anyway. Okay, it must be getting close to time for me to cut
I want
off
to finish
here.
the slides out, and then we'll have a break.
Okay, I'll go through this right here because this will be good. This is it's not very good, but this is, if you can imagine being in Argentina and looking over a field there, that's what that is. But that's a machine there harvesting something of which I'm not sure, but milk. Is it chamomile? Oh yeah, this is chamomile. Okay. A lot of the third world countries are the ones that are harvesting the herbs, and let's give you some idea. I took some pictures from some of the German magazines just to give you some idea of the more extensive cultivation of plant material than you'll see in this country. It's very seldom that I've seen fields of medicinal herbs being grown in this country. I've talked to many farmers and gotten very few of them to grow anything for me, even though they throw away most of the stuff, the dandelions and so forth. So just the whole topic of have these slides was to talk about the pesticide use and so forth. So even though you see these nice clean rows and things like that, and there's herbs that's colchicine, they aren't doing them organically particularly. So there's a problem with that. Okay, so this is
Could you remove some antibiotics usages of herbs? Is that later, or?
Yeah, I'm going to talk about. Should give you an idea what. I've kind of covered all of the things that I thought weren't necessarily highly academic, maybe in what you think it would be. But
So then tomorrow I'm going to talk for the first 2 times in a row, first in the morning. And let's see here what I have as an outline. I'm going to talk particularly about the immune system and Also, a lot of the herbs that are used in the immune system, specifically how, like echinacea, which is real strong, how to boost the immune system indirectly, like the Siberian ginseng and American ginseng, talk a little bit about that. Other immune stimulants like calendula, which I mentioned briefly. And then talk about some antivirals like lomatium that I mentioned at lunch there, and so some strong antivirals. Hypericum, go over the use of hypericum. Australian chestnut, which is antiviral. I think so. A little bit more about the lymphatic herbs. Also, get into some sedative herbs, because that's often a question I get lots of times about what to use for sedation and how that works. We talk about double-blind crossover study in hay fever using nettles. Also, the antibiotic herbs will be part of the antiviral discussion. And what else? Oh, quite a number of other things. There's one, if anybody's interested in cancer at all, I have some information on some of the old cancer, the Hoxsey formula, and then I have a tape of the Hoxsey tape about his thing. If no one's ever seen it, I brought it along. If not, people want to watch that tape. It's pretty interesting.
We can show that tomorrow. I'll bring a TV set and do that.
If you want to see it.
Ed also has a book called the Echinacea Handbook. Is that completed and for sale?
That's part of that. That's part of the volume.
Well, part of your thing. Well, anyway, it's everything you ever want to know about echinacea. And they even admonish you to start to cultivate it and grow it, because it's the plant of the future as far as phytotherapy goes. So why don't we take a half-hour break, visit the exhibitors.
Hi. Answer a couple of questions about the format of this book that you've asked me, so you understand, those of you who have it, what's in here. The material that I wrote in this book I accumulated over a period of 10, 15 years. And during those years, I worked sporadically for some of the herbal manufacturers in Utah. That was kind of where the encapsulated herbal products got started. Was in that area, and once I had done work for one of them, then the other ones contacted me to develop things for them also. And they were pretty much following the philosophies of some of the early herbalists, or in this country like Meyer and some of those, and in terms of how they formulated their products, what kind of herbs they combined and so forth. And I reviewed a lot of that and made my own recommendations to them. Completely changed a lot of the things they were doing, I think, for the most part. Some of the companies responded to my recommendations, some of them didn't. The only company that I'm aware of that does produce everything, or almost everything, that I talk about in here is a company called Solaray out of Ogden, Utah, whose products are found in health food stores. They have made a concerted effort to bring their products in line with the recommendations that I make in here. The book is broken down by chapters on different health conditions, and as I was going through here, the idea in my mind in putting together combinations or blends or formulas, if you will, of herbs was to try to be as fairly specific as I could for a particular condition, and to not be so much concerned with what might be called a total health approach to the use of herbs. So, for example, I have a chapter on the heart in which I talk mainly about hawthorn and motherwort as being good tonics for the heart. But then, if the person is experiencing hypertension, well, then they would want to go to a chapter on high blood pressure. If there's cholesterol needs to be regulated, in terms of that, they would turn to the material in cholesterol regulation. If they're experiencing a lot of anxiety and they're tense all the time, they might want to go and check out the nervousness anxiety section, and so forth, so that by adapting the various things to their own particular problems, they can then pick and choose. So perhaps they need a diuretic. Well, they can go to a chapter on the diuretics. If they need something to just increase circulation, they can go to a chapter on that. Pick and choose and combine. 2 or 3 chapters are concerned probably on a very basic level with the immune system, blood purification and detoxification, systemic detoxification, and supplying nutrients, digestion, liver. There's chapters on each of those, so that by looking at them in different ways, you can sort of tailor-make or design a system for whoever you're dealing with, or the person can themselves. So that was sort of the idea behind the organization of that. Then I do mention contraindications, other blends that would be synergistic and so forth. Toxicity, those kinds of considerations are made in there. I put this little thing on the board here, sort of an intro to, I promised you this morning that this afternoon I would talk about antibiotics and sort of give you some of the herbs that I'm familiar with in terms of their antibiotic potential. But this diagram here applies equally well to all areas of application of herbs, and I think illustrates the difficulty. If you measure the state of the organism, the person, if you will, in this case, went from a mild to a severe state on any given variable, and then you try to tailor-make a dosage of product for that particular person, you can see the problems involved. Let me show you.
If you know that you have a person that's right here in terms of how sick they are, then you can just go right up to here and then go across here and find your dosage, right? Just as simple as that, right?
Right.
Right. Problem is, how do you define that?
That's right.
You can't. I mean, it's very, very difficult to define that. He's really sick, right? Okay, really sick is here. Well, he's not too bad. Maybe that's here. Well, he's trying to prevent himself from getting sick. Well, that's probably out here or something. Well, where is it? Where is any given person on this particular length here? So if you say he's here, well, then you could come up here and say, well, there's the dosage range for that person. You could draw the lines up here for that one, and the lines up here for this one here. And so you get these big ranges of dosage that could be effective on any particular scale. That's assuming a straight line linear relationship. But what if you don't have that kind of relationship? What if the actual relationship between your dose and your condition is something like that? Okay. Now you have, he's really sick out here, you have this kind of a dosage range, whereas if he's any place close to that, then you have, you might have a very low dosage range that you deal with. Clear out to here, you just have this very narrow window to work with, don't you, in dosage, and any more than that would be an overdose. Okay, there are some conditions that it might be more like this, a negatively accelerating curve. You have something going on here, and the dose range in the mild area could be extreme, but once you reach a certain point, then it really doesn't matter how much, or when you reach out here in terms of how sick you are, then the dose has got to be high over that whole range. Obviously, to make a prediction and to understand all of that material, you have to be pretty sharp, both in terms of what you know about the activity of your product and what you know about the person that you're dealing with. What I did was live with that today.
And so it is that's why the situation can be extremely complicated. Now, the ideal approach, I suppose, is to prepare a product to take as much care as you can in terms of what you do in preparing the product. And once you think you have it, or while you're developing it, you establish a research procedure to look at it to find out what that response is, what that dose response is. So that by the time you bring it onto the market, you know the answers to these questions and you can recommend some kind of a dosage range. This is what they have to do with drugs. Before you can bring a new drug, quote unquote, onto the market, you have to do these kinds of things. Why not with herbs? Well, in Europe, they've been doing that recently. And echinacea, which is what we want to talk about today, has been subjected to this kind of approach. They standardized, if you will, the echinicides that are in the plant, which are not necessarily the only active constituent, but it's been found that if you standardize the echinicides, if you know how much of these chemicals are in the plant, then the other active conditions or chemicals co-vary with it. So relatively speaking, they will be there. Now, if that's what you use for your research, that preparation and that preparation only, then you can make some predictions about how it's going to work. And so that's what they've been doing in Germany for several years. Hopefully they haven't been using Parthenium, but you never can tell. If they have, I suppose that would justify to some extent calling Parthenium echinacea, although I have to agree with Ed that that is really ridiculous. On the other hand, I don't really agree with calling Pfaffia summa either. I mean, we're playing willy-nilly here with nomenclature that should be somewhat sacred, at least from a scientific point of view, but it's often not. So echinacea then, when they did all the research, not all of it, but as they did it and they brought it forth, then the product that was put out on the market in a guaranteed potency form was the exact product that they were using for the research. So this is one way around all of the problems of variability that you see in herbs, and one that you should be aware of as you go out and select them. If you go for something called a guaranteed potency echinacea, then you know that every time you get that echinacea, it's going to be the same echinacea that you got before. You're not going to be subjected to variabilities and preparations and so forth. And there's probably different routes to achieving the guaranteed potency concept, but they all involve the basic research on the product and its characteristics to begin with, and second, a great range of physiological studies to support its efficaciousness and its toxicity, or its safety, if you will. Two ways of saying the same thing, I suppose. One positive, one negative. At any rate, echinacea is that kind of an agent, and that's what makes it such a terrific substance to use today. Even, of course, with echinacea, even really badly prepared echinacea can have good immune system stimulant properties. It has a very good range of antibiotic activity that's direct on the organism, and some staph and some strep, for example, several strains of bacteria, let's put it that way, both gram-negative and gram-positive, have been eliminated with echinacea preparations. It is also good for the fungi, like Candida, which has been treated successfully both orally and topically with echinacea. But those are the main areas that I'm aware of that has been used for some bacteria and for some fungi. These, of course, are important when we're talking about in oral applications, because not only do these organisms thrive in the mouth, but they find ways through the mouth into the rest of the body, into the blood, and they're transferred to various parts of the body that may be weakened by some other form of infection or some form of stress, and that therefore find residence and create various kinds of infections. So when I look at the antibiotic use of herbs, echinacea can serve as a kind of a model because it does attack in several ways. But I view this as being a function of not only problems that occur in the mouth, but but ways in which organisms use the mouth to seek access to the rest of the body, and also the mouth as a manifestation of problems that are occurring in other parts of the body. There are certain oral manifestations of many kinds of infections that take place in the body, and so it can be a route you can use the oral cavity and the teeth and the gums and the tongue and the mucous membranes, and the treatment of those as a way to prevent disease in the body and as a way to treat diseases that may not have anything directly to do with the mouth, because you can seek out other portions of the body through the mouth, and that I don't mean just through the gastrointestinal tract, the obvious one, but actually through absorption into the mucous membranes, down through the gingival tissues and so forth. the virulence of many microorganisms is increased with the length of time and the number of them that are allowed to exist in the body. And as you know, many of these are in the body for many years without causing any of the problems, and then suddenly one day, bang, their virulence increases or the resistance to the body decreases, whatever, at least some sort of infection sets in. And so we have dental caries being an obvious example of something that occurs in the mouth, as our periodontal disease and gingival inflammations, subacute bacterial endocarditis that we associate very closely with problems that occur in the mouth. But what about something as simple as mumps or cellulitis, rickets, and various other conditions that we don't directly associate with the mouth, but indeed may be attacked through the hygiene of the mouth? These are things that we need to consider, I think, and there's a place for herbs in all of this. First of all, I want to run down just a simple list. Let me show you something first. This material here is stuff that I just grabbed out of my papers. These are all scientific studies that are designed to screen plants for antibiotic principles. There are a lot of them. It's interesting to see that they don't always agree. Trying to think of a good example of that. Garlic. Garlic in some studies is found to have a very good antibacterial property. In other studies, using a slightly different preparation, for example, using garlic oil, it's found that it doesn't have hardly any antibacterial property. The germs love it. They get in there and thrive in it. So again, there's that variability that does occur. They use a fairly typical range of pathogens when they look at these studies. They always use Staphylococcus aureus. They use various kinds of streptococci, the group A, group B, the beta-hemolytics, and so forth. They use Candida normally, and Subtilis. What else do they use? There's a lot of them. I'll go through some of them here and show you some of the herbs that are used against them. And you're going to see a pattern emerge. And I hope you take note of that because it's important. Let me just then summarize what this pile of paper here represents. And I didn't mention every single herb in this review either, just some of the more prominent ones. For example, looking at the Staphylococci, we have cinnamon and black cohosh, bay, berberine, various berberis species, garlic, yarrow. You want to copy all these down? Okay. Okay, garlic, yarrow, yarrow, papaya, golden seal, I said, various berberis species. That would be golden seal, and there's over 150 different species of berberis, and they pretty much have the same complement of alkaloids, berberine and berbamine and so forth. I mentioned cinnamon, anemone, anemone, I think. Black cohosh. These are some of those that we're familiar with in the West, anyway, that are very effective antibacterial herbs. There are many others, but these are some I pulled out. The Chinese form of herbs also predominate in antibacterial properties, and I didn't bother to copy many of those down for our discussion today, but if you look through texts of Chinese herbs, you will find that there are several that do apply there. The kinds of gram-positive, let's see, Staphylococci, they have the stomatitis. Well, a lot of and there's two ways they look at it. First of all, they look at a direct effect on the microorganism. Another way they've often looked at it is in a more global effect. The Russians do this a lot. The Russians very seldom look at cellular properties of anything. or if they do, it's because everybody else is looking at subcellular properties. Their research tends to be more global, more, I don't know what you'd call it, holistic in nature is one way of looking at it. They are not very reductionistic in their herbal medicine. And so instead of looking at what it would do on a particular bacteria, for example, they might look at cellulitis and find out what herbs are good for that. Or they might look at stomatitis and find out what herbs are good for that. Parotitis and so forth. And so when they look at it that way, they come about the same conclusions as the Japanese and the Americans and the Germans who are looking at the cellular effects of these things. We have that double-pronged approach. Streptococci have also been, if I'm not pronouncing these things right, that's your problem, not mine. There's nobody that I know of that I ever discuss these things with. I just sit and write, and you ever pronounce words to yourself that you never use anywhere else? And then when you get together with the people and know how they're supposed to be pronounced, whoa. So that's kind of the position I find myself in here today to some extent, because I don't usually do this. The lay people that I talk to, they don't care, and they don't know how to pronounce them either, so we're off to a good start. I can say scarlet fever, however, and scarlet fever is yielded to the application of plants like echinacea, and to a lesser extent to licorice root. The mints we have here, most of the mint family is very active in this area, as are eucalyptus, fennel, which is actually part of the mint family, I suppose. No, not really. Fennel's not in the mint family, isn't it? Coriander, parsley, and the curry herbs, garlic. Well, coriander is part of that, cumin, fenugreek. Very effective in this particular area. And you'll notice that most of those that I just read off are very high in volatile oils, aromatic principles. And the aromatic principles as a whole, as a group, have been shown to possess most of these properties, and their parent substances do also. Pneumococcus is yielded to burdock root. And we were looking at yellow dock out here, and burdock is a fairly close relative to that. It's been found to kill these microorganisms. And then most of these have a very wide range. I mean, there's a wide range of organisms that they are effective against. The lactobacilli and so forth. Let's see. We have in the entero Klebsiella, Pseudomonas. These have yielded to some of these same essential oils, such as eucalyptus, cinnamon. Juniper's effective in this area, as are berberine, rue, lemongrass. Again, many Chinese herbs, Scutellaria, which is a close relative of our wood betony. They're good against the Pseudomonas and the Proteus vulgaris, for example. Those that are causing submandibular abscesses, those that occur in many root canals, are responsible for some cases of endocarditis, skin infections that are secondary to the primary infections of the pneumonia, peritonitis, and so forth. And so there's a wide range of things there. We can go into the small gram-negative rods, and we can find the coptis root being very predominating in that area. C-O-P-T-I-S, coptis root, particularly against the organisms that are responsible for whooping cough. Very effective. Corynebacterium, diphtheria, for example, and the acnes, responsible for acne, yield to garlic and berberine again. Some Japanese herbs. Clostridium, another strain of bacteria, gram-positive in nature, yields to the Chinese herb called Cryptotympana, which is being attempted to introduce in the United States right now, and it may be good for that because it's one of the few herbs I'm aware of that has successfully been used against tetanus. And what does tetanus have to do with with dental work? I understand that tetanus can follow tooth extraction on occasion. Is that right? Anybody ever seen that happen? Or as a result of caries? Botulinum, another one that you can treat with some of the curry herbs, again the garlic and onions. And I'll be talking extensively about curry herbs tomorrow. If I don't get to it today. We get into the bacillus species or strains, and we have Bacillus subtilis is often used in these kinds of screening tests because it's very susceptible to to be destroyed by antibiotic agents, and the herb kingdom is just full of these kinds of things. Eucalyptus, again, lavender and sage, tansy, columbine, angelica, cinnamon, bay. These are some that are effective against bacillus species in time. Another one that is looked at very extensively in the research is Mycobacterium tuberculosis, which has manifestations in lesions of the mouth and face and skin and the salivary glands and so forth, and in the lungs. Very often, and the Mycobacterium leprae, which is responsible for leprosy, is subjected to studies. An herb that I want to get into at some point today in more detail is centella, a new herb in the United States that has been used very effectively against leprosy. Centella, Centella. Okay, but against the Mycobacterium tuberculosis, these kind of aerobic bacterium, we find the Japanese herb Blue Pleurum, Bupleurm, to be very effective. And in the United States, we find black cohosh. Again, we find coptis root extract. It contains berberine, by the way. It belongs in the berberis family. Hops preparations, aloes, aloe vera, rue, R-U-E, rue, golden seal again. Red clover, Euphorbia species, arnica, century, chamomile, licorice root, ginseng, elecampane, E-L-E-C-A-M-P-A-N-E, garlic, St. John's wort. These have all been shown to be effective against the Mycobacterium. And several of those same herbs have been effective against actinomycosis in some of the Russian research. The actinomycosis is kind of interesting, and it requires some breach of the tissue in order to establish itself. But when it gets there, it becomes very virulent. And some of these herbs that I just mentioned, particularly the berberine containing herbs, have been shown to be very effective against that. A lot of herbs are very good antiviral agents. Ephedra, here we're familiar with, or Ma Wang, it's sometimes called. It's from Asia. It's been shown to be very good against many viruses, as has Blue Pleurum that I mentioned. Many members of the mint family, again, have strong antiviral properties. Chrysanthemum, a common flowering plant, is very good. The echoviruses, in particular, yield to chrysanthemum in the mint family. These are the ones responsible for aseptic meningitis and various upper respiratory tract diseases and so forth. Rhinoviruses, the common cold. Hoping Ed has something to say here, because I haven't found many things that are effective against rhinoviruses, and in none of the research that I reviewed have I discovered an herb that was really effective against these. So the common cold continues to elude us on the direct antibiotic level. Blue Pleurum and the mints are also very effective against various kinds of, how would you say that, the myxoviruses. These responsible for influenza and mumps that I mentioned earlier, measles, and so forth.
Question?
Yes.
On the measles, do they actually fight the virus, or do they just
They
cause the rash to become to fruition?
They actually inhibit the virus itself. And these would be test tube studies, Petri dish studies more than anything else.
Blue pleurum.
Blue pleurum, B-U-P-L-E-U-R-M, blue pleurum. That's one of the very popular Chinese herbs, and it's one that we're seeing more and more applications in the States. One of those that I think really deserves to be brought over and looked at very closely. One of the few I really feel strongly about, I might add. Herpes viruses also have been treated with herbs. Licorice root is very, very effective against most of the herpes viruses, especially herpes simplex types 1 and 2. Type 1 being the one that affects the mouth, type 2 the one that affects the genitals. The many members of the mint family, again, are very good here, especially the oils of them. However, you would want to avoid applying some of the oils directly to small children. That's a precautionary thing you want to just don't put those in the mouth, not the oils. Teas you could. Yes, the oils can be lethal in small children.
Can you just put them on the palm of the hand?
You could, you put them on the palm, and I never heard of doing that, and just let it be absorbed systemically in that fashion. Probably could do that. Yeah, I hadn't thought about that. There's a lot of ways you can get stuff into the body, though, and I imagine an oil on the skin is a very good way. That's how we use DMSO, after all. Right? Incidentally, I experimented a long time with combining herbs with DMSO to get them into the body. It worked very well. I think it's a viable approach that needs to be explored more. The Soviets have been doing that. In fact, I have a piece of research here in which they were applying for periodontal disease, a mixture of herbs in DMSO being applied to the mouth directly, and had very good success, which they attributed mostly to the DMSO. Okay.
Is it India? Would you say the herb that they used? We didn't say.
I didn't say, just a mixture. I think Melissa was one of them, however.
What were the negative effects of DMSO?
In this particular study, none were reported. In my own research, I never saw negative effects from DMSO.
Didn't what burn the mucosa?
No, it didn't. It's a good. I think it was only a 15% solution, so it was fairly weak. Yes.
Yeah, well, I've used Procaine and DMSO applied to points for kids, that kind of thing.
Oh, yeah.
And they like that.
They like that, huh?
It doesn't hurt.
Good. I'm glad you said it, so I remember the 15% solution. I could just see you putting a 90% solution. In the side of the mouth might hurt a little bit. Viral hepatitis, we can mention that because that's a very common sort of disease. I think one of the best herbs for treating that is licorice root. Viral hepatitis can be caused by a wide variety of infectious agents. Everything from coxsackie to yellow fever, even herpes simplex can lead to viral hepatitis. And so licorice root has been shown in several trials in Germany to be very effective, both as a preventive and as a curative agent, a good treatment.
How was that taken? How was that taken?
As a liquid extract. Also milk thistle extract, silymarin, milk thistle, I call it milk thistle extract, has been shown to be effective against several strains of viral hepatitis. Okay, let me skip down here a little ways so we touch upon mycology just a little bit. Ligusticum and magnolia are two of the premier herbs to go after superficial mycoses. Ligusticum, Ligusticum. I'm feeling just a little bit tongue-tied today too, so forgive some of the mispronunciations. When you grow up in Washington State with parents who were raised in southern Utah, you do not learn how to talk. And I have several of these speech impediments that sometimes crop up. Like if I have to say two words in a row that have AR or 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 UR sounds in them, forget it. I'm sorry. But even if I concentrate real hard, I will reverse those R sounds. And when you're born in a barn, like they are in Utah, and raised in the carn,
Dixieland.
yeah, you have real problems, like trying to say Star Wars. Star Wars, is that right? Sometimes I go Star Wars. Anyway, I'm feeling that right here today. In fact, if somebody could give me some water, that might really help here. Anyway, ligusticum and magnolia are two of the primary agents, antibacterial agents for treating the superficial mycoses, such as, the microsporum, the trichophytum, and so forth, Tinea ringworms here we're talking about mainly. But the ringworms can occur anywhere in the body. You've got feet and groin and scalp, and nails, and so forth. All of these can be treated pretty well with these herbs. Osage orangewood has been subjected to pretty good research trials, OSAGE, orangewood, and found to be effective against these same kind of agents that cause ringworm. Now you've got then your deep mycoses. This is a fairly heterogeneous group, and this is where Candida falls. And Candida is one that has been subjected to a lot of study simply because when it does manage to gain a hold in the body, it doesn't want to let go, and it manifests itself in some very debilitating ways. One of the most effective, powerful agents against Candida is found in garlic. The allicin, the primary active ingredient in garlic. But onion also is effective. Echinacea, pau de arco, or lapacho, or tahibo, or however you want to call it. There are several names, but it's a South American herb of recent entry into the United States. Pau de arco, P-A-U-D'-A-R-C-O, was used in many trials on Candida and found to be candidiasis, and was found to be very, very effective. Garlic has been subjected to the same kind of trials and also been shown to be very effective. Eugenol, an oil, essential oil extracted from cinnamon, cloves, and allspice, has been used in dentistry to a great extent to treat the Candida colonies that exist in the mouth. And when you get a Candida infection anywhere in the body, if you attack it through the mouth, you can achieve that an end of curing it in the rest of the body. So it's a very good oral application. The Candida in the oral cavity can be benign and yet lead to problems in the rest of the body. So I don't know exactly how the mechanism works there, but if you can begin to treat kill the Candida in the oral cavity, then the Candida in the intestines and the vagina and the bronchia also will succumb. But just because somebody measures you and you find out you've got a lot of Candida in you doesn't mean you're going to be sick. Large populations of this organism survive in the body for long periods of time without causing any problems. But sometimes when a person becomes diabetic or becomes anemic or undergoes any other form of altered metabolism, then this gives place for the Candida to begin. With the breakdown of the normal defense mechanisms, the Candida is given a chance to begin to be infectious, to become virulent. Okay, let's see.
Has that been shown that it is the mycelium form that is the virulent form?
Yes.
About that? Is that true?
Yes, that's true. Okay. Well, then there's very miscellaneous fungi that are subjected to the use of herbs. Leishmania tropica, for example, and various amoebas, and we've got cholera and diarrhea and gastroenteritis that can come from entamoeba infections. Cryptococcus infections are also treatable. Incidentally, Cryptococcus meningitis, a fairly deadly disease in Asia, has been resistant to almost all standard treatments, and yet has been treated successfully in 9 out of 10 cases in the study I looked at with golden seal extract. So a golden seal turns out to be the primary treatment regimen for this particular very deadly Cryptococcus infection. Okay, then there's various worms and so forth that aren't really that important, but those are the main ones I think that concern us from an oral point of view. Yes?
Can you give some parasite information?
Well, I talk about black walnut and garlic a lot for that, garlic being a very good anti-parasitic substance. Again, the berberine. There's a Chinese herb called Scutellaria biacalensis, and again, I don't really have to pronounce that, but that's the name of the herb, which we're looking at more intensively now in the West. That is also good against parasitic infections.
What kind of parasites does it?
Namely, we're talking about spirochetes. See, that's what I was trying to say. I was getting there. And Neisseria, gonorrhea, syphilitic kinds of things. Okay, meningitis. Question?
How about worms?
Well, that when you get down to an anthelmintic or a vermifuge, then garlic becomes the primary herb of choice, I think. And black walnut is very good too. But there are some studies that back that up, but mainly what you have is hundreds of years of good folklore use, and it's pretty hard to miss. It either works or it doesn't. If it works, you've got the evidence at hand. Okay. All right.
Are there any that treat trichosomes?
None that I'm aware of. No, not specifically. Let me make sure on that. I don't think I have a note by that at all. Most of the other ones. Now, trichophyton, no. That would just be a ringworm, and there are some that treat that, but not trichinosis. Okay. Now, some of the specific things we might want to look at here just a little bit. I already talked about cinchona being a good anti-malarial. And it really is, and has been used over and over again as throughout the South America. They still use cinchona, and we can get it in the United States too, cinchona bark, to be used instead of quinine in a lot of our healing practices, mainly because it does a lot more than is just an antibiotic substance. It does get after a lot of bacteria and bacilli and so forth. Its profile is pretty well known, but again, it's also an antipyretic. It's a good pain-reducing substance. It's antagonistic to thyroid hormone in the sense of lowering the basal metabolism. It has some mild activity on the heart. And some other things. It's also a good stomachic and astringent and appetite stimulant, used both in allopathy and in homeopathy. It has a wide range of uses. It's kind of fallen out of use in the States, but we should look at it. Cinchona, C-I-N-C-H-O-N-A. Okay, I didn't mention it because it's more of a widespread thing, and I didn't want to put it within the context of these other ones I was giving you here. So as we look at some of those then that I mentioned, there should be a couple of things that should have occurred to you. One I've already mentioned, that we're talking here about a lot of herbs with volatile oils. And so a lot of these are very pleasant to use. Some of them are not. Valerian root has some antibiotic activity, but it has some essential oil, but it's not very pleasant. But most of the mint family is a very pleasant group to use that can be used for mouthwashes and for teas and and these kinds of things that would directly control the microflora of the mouth. They are very pleasant to use that way. The curry herbs are here often mentioned, which can be used in foods, in cooking, and so forth. These are things that we don't use so much in modern America, and we should, because they can control the infectious state of the body, or they can reduce its susceptibility to infection. They can be used on a daily basis. There's a great variety in them. You can use one today and another one tomorrow. Mint today, catnip tomorrow, peppermint, wintergreen. fennel, anise, and so forth. Curry herbs, you can be using garlic in most of your meals. You can use a lot of onion. You can use turmeric today and maybe some coriander or some cumin the next. You can vary these things up, and by doing so you gain, I think you achieve what I would call a broad spectrum approach to the control of the control of microorganisms. In all of the research that I looked at here, these particular plants lack toxicity against what you might call the good bacteria. And I think this is an important point that is often overlooked. Golden seal, for example, has often been gotten a bad reputation because people began claiming, yes, it's going to kill all of the good bacteria along with the bad bacteria, but that's not nonsense. If you look at the profile of golden seal as an antibacterial, antiviral agent, you find that it's fairly specific against certain bacteria, but none of which are what we call the good kind.
How about tea tree oil?
Okay, tea tree oil. Yes, as a matter of fact, tea tree oil has been recently looked at. I think I have some things on that here that I wanted to talk about specifically. For those of you who don't know, tea tree oil or has come to us from Australia, and was introduced not too long ago as being good for what ails you. It's produced on a plantation or several down there, and looks like it's going to be another really good herb. It has been used directly in dental kinds of settings. In the Australian Journal of Dentistry, for example, in 1930, as far back as 1930, they were looking at it as an antiseptic. They found that it had very high antiseptic power with non-irritating effects on the tissue cells, and was very non-toxic. More recent trials have tended to extend and verify that research. A germicidal effect, this antiseptic effect in the mouth, pleasant to take. Some clinical studies have been done against a candida and Staphylococcus aureus, Proteus, enterobacteria, and so forth, and been found to be effective against all of those. Let's see. Chronic idiopathic colibacilli cystitis in 26 patients whose average age was 39, they found that it was effective as a curative agent. And that was a fairly good study. It took place over a period of 6 months, involved, as I say, a couple of dozen people. They had the precise doses that were given each day to each of the patients. It was a semi-double crossover study, double-blind crossover study. After a month, they had 3 or 4 of the patients were totally recovered, and over the next 3 weeks they had more. After 3 months, they had 13 of the original 26 were totally recovered, and after 6 months, they still had about 5 or 6 patients that had not recovered yet. They declared that they reduced it eventually to 2 patients that they thought did not respond to the treatment, so that's pretty effective. In a study in 28 cases of candida infections, they used tea tree oil and found that it was also very effective there. The essential oil, this is an oil of tea tree we're talking about. They found that treatments of long durations, up to 60 days, daily treatment of this oil on the tissues of the mucous membranes was still well tolerated and produced no inflammation, no allergic reaction. So tea tree looks like it's going to come on and be a pretty good stuff. It's effective against several of the more commonly researched organisms, and it is effective in clinical settings. Yes?
Is it ever taken internally in any form?
Yes, it is. Tea tree is taken internally, but I'm not sure under what conditions.
What, 3 or 4 drops? Or?
Yeah, I think, let's see. You think for a minute. Tea tree, I think that's what's recommended. Just 3 or 4 drops in a little alcohol or water or milk or juice. It's taken internally at times. In a wash inside the oral cavity, it's applied. I think it's diluted again, maybe several drops in a teaspoon of water or something like that. They would use in the oral cavity because as an antiseptic agent, it has to come in contact with those membranes.
We use it for about 11 years now in the hygiene program, and we have our hygienist dip her curette every time she goes to scale an area, and she really likes it. It's worked out
For 11 years?
Yeah.
See, I just thought it was brand new. That just means that I brand new saw it a few years ago. Okay, that's good.
How do you spell this?
Just like it sounds, TEA, tree, TREE, 2 words.
There's another name called oil of melaleuca.
Melaleuca officinalis is the botanical designation, right? Okay. Melaleuca spelled MELALEUCA, and it's not officinalis, it's alternifolia, ALTERNIFOLIA. Okay, so that takes care of tea tree.
Can that be taken as you say, as an antibiotic? Would you put that in antibiotic anywhere too? Then I think, right?
Oh yes, I definitely include it there. Okay. One of the plants I didn't mention was Uva ursi, UVAURSI. Uva ursi, Arctostaphylos uva ursi is the botanical name, and thyme, which have both been subjected to pretty good screening tests for the presence of antibiotic substances and are found to have fairly wide-ranging effects against many of the microorganisms we've been talking about, and which I would recommend as part of any treatment program. They could just be taken internally, they can be used in foods and so forth. I didn't mention those. Of course, echinacea is one that has... Okay, well, I don't want to talk about echinacea just yet. Let me get through here. A couple of these other ones. We did talk about golden seal. It has very good antibiotic activities. Again, also with golden seal, I want to mention one other organism. That's why I wanted to talk about golden seal. Not only is it effective against staph and strep and corneobacterium and Diplococcus, pneumonia, candida, but it's also one of the few agents that's effective against giardia. And how many of you are familiar with the giardia? Everybody? Okay, good. If you live in Utah, you live in fear of giardia. I don't know, how is it down here? You have the same problem. Okay. All right, well, that's right. You guys were robbing your water from the Rocky Mountains anyway. Anyway, you know that the most small towns are protected in their water supply by an earthen dam, and that the natural silts and sands that build up behind the dams is the filtration device for the water, and it's very effective for most microorganisms. Unfortunately, giardia concentration builds up in these sand and silt basins until it saturates them and then just comes right through in the water. And that's beginning to happen in towns throughout the western part of the United States now. And in Utah in recent years we've had about 4 epidemics of giardia that have been caused directly through that mechanism. About the only water filtration system that can get rid of it is the reverse osmosis filtration. Every other, chlorine won't kill it, fluoride doesn't kill it. Most of your water treatments do not touch giardia, so it just comes right on through. So it's nice to have something that will treat it, and that is not a sulfa drug or some other very potentially debilitating drug. Golden seal extract, hydrostein, the active constituent of golden seal, which is not found in the other berberis species, it turns out to be the chemical that is responsible for killing giardia in that plant. And in the studies that I've read, it's been what I would call moderately to very successful in the number of people that totally recover without recurrence from giardia infections.
How long do you have to take it for? Can you take it for?
The studies usually went 1 to 2 months of daily treatment 3 or 4 times a day.
There's no problem, you say, with golden seal taking it for that long that you know of?
No, not that I know of.
What kind of dosage?
I can't remember right offhand, and I was going to bring that particular one of those research papers with me, and I didn't get it in, so I can't tell you exactly what the dose was on that. It was probably fairly high, and if you were to use whole golden seal, I would be using or extract or herb material in a capsule or whatever way you wanted to use it. I would be using quite a bit, I think, because it was a fairly stiff dose that was being administered. That I remember.
Could it be used as an enema or anything like that also, I mean, in this situation where they have Giardia?
I don't know whether it could be used as an enema or
It's a
not.
long way to get up to the duodenum, and that's where the Giardia
Yeah.
reproduces itself.
I see.
Yeah, that'd be hard. Okay. So anyway, that's one way that herbs can be used as good agents to kill, as there's a direct antibiotic property. But I think one of the most effective ways that herbs are used is in their effect on the immune system itself. That is just keeping the body in such a state of health that these agents cannot get a hold. Obviously, if a person's under a stress or is subjected to a trauma such as oral surgery or even having a tooth extracted, this can put them in a state of compromise, and they can then yield to the presence of several of these